Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Years ago, doctors typically advised cancer patients to rest and avoid physical activity as they went through treatment. But today, thanks to extensive research into the benefits of exercise, we know that being physically active is essential for people going through cancer treatment, as well as those living with and beyond cancer. Research shows the importance of adding some form of regular exercise to your daily life, even during cancer therapy. Even moderate aerobic exercise, such as riding a stationary bicycle or taking a daily walk, can improve well-being and motivate recovery. If done regularly, aerobic exercise can help reduce anxiety, depression, fatigue, and improve quality of life and physical function in cancer survivors. With me to talk about the benefits of exercise for cancer patients before, during, and after treatment is Kelsey Engat, an exercise physiologist and fitness program and personal training instructor at the University of Kansas Health System, Sports Medicine and Performance Center in Overland Park. And joining her is breast cancer patient and exercise enthusiast. I wish I was introduced as an exercise enthusiast, but Sharon Jones. Sharon is a former aerobics instructor and actively participated in fitness competitions and dance for years. She was diagnosed with metastatic breast cancer in April 2019. Thanks for joining us for today's episode of Bench to Bedside. So Kelsey, I'm going to start with you. Why is it important for cancer patients to exercise?
Well, it's not only important for them to exercise for physical benefits, but for as well as mental benefits. Exercise has been shown to decrease depression and anxiety. It can increase your energy, your strength. It can also trigger a positive immune response, which can lead to better outcomes.
So, Sharon, what is your take on the role of exercise as a cancer patient?
As a cancer patient, I have always exercised all my life and competed. And for me, it was just as the instructor said, depression. It helps me through getting through my day and not think. It gave me something of my own because exercise is a passion for me. So it belonged to me. Even though I did have someone to intrude into my body, I enjoy exercising. I enjoy walking. So it made going through my journey a little bit better.
Good. So, Kelsey, one of the things that I often hear is that exercise may be a way to help mitigate the fatigue and nausea and perhaps pain associated with cancer diagnosis or treatment. Could you tell us about that?
Certainly. There's many different reasons why exercise can help with these things. One of them is just the endorphins that are released during your exercise. The feel-good endorphins can help, like you said, your mind and your body feel better. It can also keep your muscles from deteriorating and from mitigating bone density loss while you're going through treatment. And it can also just improve the overall blood flow throughout the body, therefore increasing energy, feeling better.
Mm-hmm. So Sharon, what advice would you have for our cancer patients about the benefits and importance of exercise during this whole journey that you've had over the last year and a half or so with cancer?
Working out, exercising make me as an individual feel better. It does it improves my mental state of this. I have never been to a doctor as much as I have seen Dr. Khan in the last year and a half. It makes me feel better when I walk. I can focus on what I'm doing and bettering my health. I've always been healthy, but trying to have something to fight against. It keeps me from being depressed. I don't have any nausea. It helps with that. Helped me sleep better. It helped me can be able to manage my pain a little bit better than what it would be if I didn't have anything to focus on.
So I think, a lot of people can probably, they certainly understand exercising before a cancer diagnosis or maybe helping you get back to normal after treatment. But I'd like to explore with you a little bit more about why you felt it was necessary or helpful to exercise during your treatment regimen. I think that may be something that our viewers would be really interested in hearing about.
Well, for me, I do go to a regular gym, but I always had a personal trainer. And being around people that cared about me and we experienced the same thing, same experience of wanting to better our health, it did something for me. It helped me to want to fight, to be better at this. This is like something really like new to me. So being in the gym around positive people and telling me that you done been through competitions and disappointment things, you can make it through this. So exercise was like it was like an escape for me, because I'm used to exercising almost 5 days a week. So being around my friends and being encouraging, it was positive to me. So I encourage anyone to find a walking person, someone to walk with. It just be encouraging to be around people who have that like mind like you do. Like, we want to exercise together. They pushing you to do better, to be better, and to walk this journey with you.
That makes great sense. Kelsey, when would you suggest that a cancer patient begin an exercise program?
Truly as soon as possible. I mean, kind of depending on what the physician is saying to them, obviously, but before, during, after treatment, there's benefits to utilizing exercise all the way through.
Mm-hmm. So if you're just joining us, we're here with exercise physiologist Kelsey Engat and metastatic breast cancer patient Sharon Jones to talk about the benefits of exercise for cancer patients before, during, and after treatment. If you have any questions, post them in the comments section below. And remember to share this link with people who may benefit from our discussion. Use the hashtag #BenchToBedside. So Kelsey, do patients need to be approved prior to initiate an exercise program by their physician?
Yes, at the Performance Center with us, we do recommend physician approval, just because there's so many different types of cancer, so many different types of treatments. It really helps us to know what kind of medications they're on, what the side effects of those medications may be, so that we can plan the exercise program properly for that individual.
Mm-hmm. So we've talked about aerobic exercise. Is that the program that both of you engage in, or do you add in weights, or what all do you think is an appropriate form of exercise for folks?
I really believe that the strength training part of it is a very important part. Again, the way that strength training will load the muscles will help keep the muscles from deteriorating. It will keep that bone density healthy. It can also just give your body that overall strength, a little bit extra strength. The cardiovascular training, focuses on the heart and the blood flow. But the strength training is just as important. And then for me, I also really focus on a good stretching and soft tissue regimen. Sometimes medications can really wreak havoc on our soft tissues, and so learning how to properly stretch the body and alleviate some of those aches and pains that can happen is really important.
Sharon, what all types of exercises have you utilized during your journey?
I do aerobics and I weight train. I do mostly strength training, and was preparing myself for different competitions. I do a lot of squats. I do a lot of running. My favorite body parts are my shoulders and arms. So I do a lot of working on them. Ab work, doing dancing. I also stretch. I do a lot of stretching. I try to stretch before and after I work out. I feel that relieves the fatigues that I have before I work out and help me doing workout.
So Kelsey, what type of services are available at the Sports Medicine and Performance Center for our patients?
What we do is we offer one-on-one personal training or potentially small group training to any of the patients that are looking to come through. Those all start with a personal biomechanical assessment of how your body is doing, as well as a referral or a discussion with your physician. So again, that we know all of the ins and outs to your specific case, and then we can really tailor a program for you. And it can be something where you come to work with the trainer for every workout, or where we help design one for you and teach you how to do it so that you're able to do it on your own.
Okay. So what types of exercises, say, would you recommend for someone like Sharon, who's just had a breast cancer diagnosis, may have had surgery, radiation, and is now undergoing chemotherapy?
Again, I would recommend the combination of all that we talked about before, the strength training, the cardiovascular training, as well as the stretching program. Something with breast cancer that I often see is deactivation of muscles and tenderness of tissue, throughout the area. And so just being really specific in the exercises that we designed for strength around the area that's been treated.
So are there any exercises that, say, apply better to cancer patients than, folks, say, before their diagnosis, like things you particularly want to work on or focus on?
A lot of times when the body is in a state of disease, again, we don't have the proper muscles that fire. We don't always have the proper movement that happens during exercise. So one thing that I focus on with my cancer patients is really, I call it mind and body, but making sure that you are exercising properly so that we are utilizing the muscle and not the connective tissues, so that instead of increasing soreness, we are increasing strength.
I see. So Sharon, how did diagnosis and treatment alter your exercise regimen, or did it in fact alter that regimen?
Just a little. I don't do heavy lifting weights as I used to. Also, since I have feet and hand syndrome, it's kind of hard for me to grip heavier weights, so I do lighter weights. Instead of running, I'm used to running, I do a lot of walking. So it has alternated it a little bit, but I'm trying to bounce back.
I see. So one other aspect of I think folks may be interested in is your participation in our Pivot program. Could you tell us a little bit about that and kind of what stimulated your interest to join that particular group?
Well, one of my friends, my survivor sister is Kim Jones, and she invited me to one of the meetings. And surprisingly, I knew a couple of people like Broderick. And so it informed me, because I knew nothing about cancer. I knew nothing about breast cancer and advocate. So it informed me, it started informing me and getting me to go deeper and research different cancers. Especially since I have metastatic breast cancer, I have never heard about that until I was told I was diagnosed with it. I never heard of MBC at all. And it gives me a outlook on different people. We have, in one meeting, they had the different ones stand up and talked about their cancer, and even if there was a caregiver. But it inspired me to want to be the advocate and help others who can't speak for themselves or don't have the outlet to speak. Like we have, we can tell how a patient might feel. Some of the cases that I go to In My Own Voices by Susan G. Coleman, and we able to express ourselves, because some patients don't know how to talk to their doctor, they don't know how to talk to their oncologist. Because I was one of those until I started talking to like Kim and different people at Pivot, and they told me that just write down different things, questions that I might have for Dr. Khan, and ask him. And don't be afraid to ask my oncologist different things. So I think Pivot had helped me to open up, and I was like closed in.
That's great. Nobody warned me that you were friends with Kim and Broderick before this broadcast. So somebody's gonna be in trouble. But no, I'm just kidding them, and I know they're probably listening in, so they'll get a bang out of that. So thank you so much, Sharon, for being on the program today, and obviously thank you as well, Kelsey. I think both of you did a great job, and I think you've really emphasized why exercise is such an important part of kind of recovering from cancer and getting back to normal and making you feel like you have the control back. And I know that's an issue for a lot of cancer patients.
Yes.
So thank you so much. That's it for today. To learn more, please visit kucancercenter.org. Join us next time for Bench to Bedside. Thanks for watching.